Good morning. If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a great number of your future patients. Remember, with the description of this video you can find a link to free training classes on clinical hypnosis. And also, you can download several ebooks also free. The information in this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis of our publisher Clinical Hypnotherapy, registered with ISBNs. Direct Clinical Hypnosis. Treatment Design. Treatment Design. In the first session, we deal with the interview, semi-structured interview, to gather information about the possible disorder to be treated. The first session will be to diagnose, demystify hypnosis, to clarify the doubts that the patient has about what he or she thinks hypnosis is, and to carry out relaxation tests. The first session would be therefore a contact session. For the diagnosis we use the DSM, Diagnosis and Statistical Manual of Mental Disorders. When we apply the relaxation test, what we actually apply is an introductory exercise to hypnosis. In other words, we tell the patient that in this first session we are only going to apply a relaxation, a small relaxation, to check the degree of depth that he or she reaches with relaxation. But in reality, what we apply is a hypnosis session. This deception is to show the patient that if he or she is calm, relaxed, and confident, he or she will enter hypnosis much better. If the first time we tell him or her that we are going to apply a hypnosis session, he or she may feel some kind of fear, and therefore he or she will show resistance to enter into the hypnotic state. In the second session, we apply the HPCs method to introduce the key. Keywords is the key to re-enter the deep state in which the patient is. Then we apply the treatment that we have already designed, as we have a week to do so. Depending on the diagnosis, we will apply one treatment or another. In the first session, information has been gathered for this. In the second and subsequent sessions, we can also gather more information to improve the treatment. Although, with the information from the first session, we already have enough information to design the treatment to follow. There are therapists who make this diagnosis in 2 or 3 sessions. We do it in 1 session. In subsequent sessions, we can gather information that will surely help to improve the treatment, but we have the bulk of the information from the first session. In this way, we start working in the second session with the treatment already designed. As we progress in the therapy and obtain additional information, we will modify the treatment in order to follow the most effective therapy possible. The first session can last several hours. We have spent up to 5 hours, but the patient leaves the session with a diagnosis. That way, the following week, when the patient returns for the second session, the treatment is already designed. Once the treatment has been designed, the therapy can begin. We cannot use several sessions for diagnosis, as this would mean delaying the treatment for several sessions. In these times, the demand is for speed. Therefore, we recommend to diagnose in the first session and use information in the remaining sessions to improve the therapy. The following sessions are usually 90 minutes long, about 30 minutes of interview to see the changes and progress made during the week, and 60 minutes of hypnotic session. Once the key has been introduced, in the following sessions we will start with the exercises to introduce the trance with key or double key. Now that we have the patient diagnosed, we are going to design the corresponding therapy. As we have seen before, we have primary, secondary, and tertiary exercises. A good therapy would be to know which primary exercises to use, with which secondary exercises we should combine them, and with which tertiary exercises we can reinforce the therapy. If you're interested in learning more about clinical hypnosis, watch our next video, Direct Clinical Hypnosis, Treatment Design Part 2. Remember to read the description of this video where you can find a link to free training classes on clinical hypnosis, and also you can download several free ebooks. If you have any questions, add them in the comments area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So if you're interested, do not miss our next videos. Thank you very much for your interest.